Hey, Audrey, you call me? Uh, well, channel one, should be channel one, yeah. Okay. Right.
Hi everyone, thank you for joining us today. I am joined by my colleague and friend Brent Roussin, who is our Minister of Health, Seniors and Active Living. I'd like to take the time today to acknowledge so many community partners who are stepping up, helping other Manitobans during this time of need. The town of Lac du Bonnet hosted a teddy bear hunt. They encouraged all their community members to put a teddy bear or a stuffed animal in their front windows for children and their families to see while they're out for a walk or a drive. Thank you for doing that. The Dynamo Girls Club volleyball team are using technology and social media to host team bonding events and challenges to do their best to stay active. And to date, we have seen more than 5,500 volunteers sign up for Help Next Door Manitoba, right across the province, close to 160 cities and towns all over the province of Manitoba. So I want every Manitoban to know how proud I am of them for stepping up, for working together, for helping their neighbors and taking every precaution necessary to help each other overcome these uncertain times. It is vitally important in unprecedented times like these to ensure our healthcare system is able to quickly respond and adapt to ensure the health and well-being of all our citizens. This pandemic will undoubtedly place extra strain on our healthcare system, and we must do everything we can to ensure it's there for us and our loved ones, not only today, not only during these times, but in the future as well. We must do everything we can to support our frontline workers too. Our healthcare workers are our heroes, and we have to prepare for the hard work ahead, and that hard work, much of it will be done by frontline healthcare workers. We thank them too. Il est important en des temps sans précédent, comme celui-ci, de veiller à ce que notre système de santé soit en mesure de réagir et de s'adapter pour assurer la santé et le bien-être de tous ses citoyens. Cette pandémie mettra sans aucun doute une pression supplémentaire sur notre système de soins de santé et nous devons faire tout notre possible pour nous assurer qu'elle est pour nous et nos proches aujourd'hui et à l'avenir aussi. Nous devons faire tout notre possible pour soutenir nos agents de santé de première ligne et nous préparer au travail à venir. Resiliency matters. Our healthcare system always matters, now and forever. Together, we're dealing with extraordinary measures and extraordinary times, and today, the Minister of Health, Seniors and Active Living will be announcing steps to increase our nursing capacity on the front lines as we face this pandemic together. Cameron?
Thank you, Premier. Good afternoon, everyone. As we know, we are in unprecedented circumstances during this pandemic. Our government recognizes the incredible strain on our healthcare system as a result. And so first we stop to say thank you to healthcare workers and all Manitobans and healthcare workers who have stepped up, who have reported for duty, who are protecting people, who are serving their patients each and every day during this COVID-19 epidemic. We have seen what has happened in other jurisdictions when preparation is insufficient. And that is why Manitoba is taking action to ensure that our healthcare system is ready. We've been working in collaboration with colleges, including the College of Registered Nurses, with labor unions. We all recognize the need to enhance our current system, including our current workforce. And we have found a way to invite nurses in our jurisdiction back into the workforce, including former registered nurses. Today, I am pleased to announce that I am issuing a directive under the Regulated Health Professions Act. This order enables the registrar of the College of Registered Nurses of Manitoba to waive or modify registration requirements for former nurses to essentially fast-track their return to practice during this pandemic. Aujourd'hui, nous sommes fiers d'annoncer que nous prenons d'action pour permettre aux infirmiers et infirmières un chemin, une façon de retourner au système de soins de santé, de retourner sur le marché du travail et soutenir les efforts contre COVID-19. The nurse returning to practice must have been a member of the college in good standing with authority to practice within the last 5 years and must be able to safely provide care. I would also add the registration fees for nurses will be waived during this process. The college is underwriting those fees. The province is contributing a portion of the fee, and as a result, there is no cost for a former nurse to re-enter the workforce at this time. This will allow nurses more easily to come back and help out, to be part of the effort without paying licensing fees. Our government is taking action in a timely way. We know that now is the time to broadly solicit for help. And I'm not just talking about former registered nurses, but also nurses who have returned from other jurisdictions to Manitoba as well. To those nurses in Manitoba, we say if you fit these criteria, we are asking for your help. This could be nurses who are working part-time. This could be nurses, as we said, who are recently retired. This could be nurses that are teaching at the moment, who are working in administration. There are many other examples of support being expressed each and every day by Manitobans in the fight to flatten the COVID-19 curve. As previously announced, we reached a memorandum of agreement with Manitoba nurses. Both groups came together to find a solution for a contingency plan that would provide certainty and ensure that staff will be there for patients and to ensure that patient safety comes first. We are also prioritizing screening and COVID-19 testing for nurses. Manitobans know that we have prioritized childcare spaces dedicated to frontline healthcare workers, including nurses. I also want to recognize 94th-year nursing students working at HealthLinks InfoSanté, and also undergraduate and graduate students from the University of Manitoba are assisting the work at Chatham Provincial Laboratory and the public health work that is going on there. As well, a big thank you to the almost 100 doctors who have now already stepped up to take on additional hours at clinics and hospitals. We are continuing to work with our federal partners on the issue of the personal protective equipment for nurses and frontline staff. We are acting out of an abundance of caution. Our government and healthcare leaders are working cooperatively. We have taken numerous measures to keep Manitobans safe. We will continue to update Manitobans as we take action in an ever-evolving circumstance. Once again, in closing, I thank all Manitobans for their efforts. I thank them for their cooperation, for their compliance, for the orders that we are issuing, and for their compassion and the ways that they are reaching out and reaching across the distance that COVID-19 creates. Thank you, Premier.
Thank you, Cameron. Thank you on behalf of all of us for your work and for the work of your team and your department. You've been leading the way. I want to say also thank you again to our frontline healthcare personnel, selflessly dedicating their time, their energy to the front line of this health pandemic. We're taking these steps in partnership with our frontline workers and our healthcare leaders so that we can protect our most valuable service, our healthcare system, today and tomorrow. And we're doing that so we can protect people when they're vulnerable and when they need that system to work, and they need it to work now, and they will always need it to work. I have no doubt that many retired nurses are going to want to come forward and support their colleagues, and I thank them for that. This is a difficult and unprecedented time, but I know that nursing is a caring profession, and I know that nurses are caring people. We're going to flatten the COVID curve, and as we do, we will ensure that all of us and our loved ones have a healthy Manitoba today and also sustainable Manitoba going forward. So to all Manitobans who are doing the right thing, protecting themselves, protecting others, remember, not every generation has the opportunity to save a life, but you do. Stay positive, encourage one another, help one another. We will be back. We've been the home of hope for over 150 years now, and we will continue to be the home of hope. And together, we will beat this thing.
Thank you very much. A reminder to the reporters online, you will have your primary question and a follow-up. First, we go to CBC Manitoba and Bart.
Bart Matita, CBC Manitoba. Minister, can you please comment on the transmission of the virus within the healthcare system? We now have at least 3 confirmed reports of healthcare professionals contracting COVID-19.
Yeah, thank you for the question. So we know this is not ideal. It's not ideal to have nurses and other healthcare workers who are suddenly finding themselves facing a 14-day isolation order. I can tell you that it's a quickly evolving situation. We know that this issue has been faced in other Canadian jurisdictions and indeed around the globe. We're taking action. Your Chief Provincial Public Health Officer will be behind this microphone shortly from now, and will be providing a full update on how we're taking action to protect those who are serving us in our healthcare centres.
Follow-up for you. Some larger Canadian provinces are building temporary hospitals and doing other things outside the hospital structure. We know Manitoba is looking at placing some COVID patients in hotels. What does Manitoba plan to do to expand hospital or treatment infrastructure outside of physical hospitals in the event that this surge, to prepare for the surge that's coming?
So there's significant efforts, as you know, underway in hospital to create and to expand the capacity that we have. While that work continues and is proceeding very rapidly, we're pleased to know that those plans are in place. But as you say, those plans are not limited to what we could do in a moderate event. We are in every case hoping for the best while we plan for every eventuality. The plans that you reference are indeed being worked up.
Just clarify there, you mean temporary hospitals?
That's correct.
Thank you.
Next, we have Mark from City News.
Hi there, Mark Neufeld, City News. You said now's the time to broadly solicit for help. Is that because we are expecting more frontline workers are going to be contracting COVID and they'll be pulled off for that 14 days, and this is a way to sort of get a backstop ready before that happens more frequently?
Backstopping is an important way that we prepare. It's not the only way we prepare, but certainly we've said that we are pulling out all the stops when it comes for making our system ready, and one of the ways we will do that is to solicit for that help from people who have been in our system. It's an important way. We've already had expressions of support of former nurses who want to help out in this way, and so we're pleased to be bringing this action in conjunction with the College of Registered Nurses of Manitoba to create the pathway for those outside of the system to re-enter it.
Let's be very clear though, Mark. This announcement today has been in the planning stages for a number of days. It isn't in reaction to an event at Selkirk or any other event. We've anticipated that unfortunately was going to be the eventuality, as it has been in virtually every other jurisdiction, where unfortunately healthcare professionals on the front line occasionally are going to be exposed. So this is not to be linked to the event of yesterday. This has been in the planning stage for the last few days.
You talked about over 5,000 volunteers helping to step up. I know businesses are also helping supply items like surgical gloves, surgical masks, and IV pumps. Do you need businesses to provide specific items right now more so than any other?
We certainly do. It's why only days ago we announced the opening of a portal, an internet portal for business, manufacturers, retailers, industry to be able to signal that they could provide goods or services that we need. We created a list, a detailed list of what we're looking for. Certainly we're working with our federal cousins on these issues, but our efforts are also unique in jurisdiction. We are leading those efforts, and only days ago we found ways to re-resource that work with a new table that's leading that charge to engage people to say, here's the supplies we need, and we need them now.
I'm very proud of the small business community in our province for stepping up. In some other jurisdictions, nationally, internationally, governments have had to resort to other approaches to ensure capacity or procurement. But here we've had tremendous response from our small business community. These are people who are really demonstrating their sense of duty and citizenship to us.
From the Winnipeg Free Press, Carol.
Hi, Minister Friesen. Have you been briefed on how many hospital workers have tested positive and are self-isolating, and what measures are being taken to protect the frontline healthcare workers now?
So I do receive those briefings daily. There are still some numbers emerging today, but as it was previously referenced, there were 3 incidents in which someone came to work sick, and as a result of that, there was possibly transmission to others with whom they came in contact. Now, the Chief Provincial Public Health Officer will be here shortly to detail significant plans that we will put in place immediately going forward. We have said that as a government and as a key healthcare leadership group, we plan to do everything we can to keep healthcare workers and those in hospitals and healthcare settings safe, and we plan to do exactly that.
My follow-up question is for the Premier. Premier Pallister, late yesterday I noticed about a person with COVID-19 at Club Regent on March 16th was posted online by Public Health. Are you disappointed that the public wasn't made aware of it until 15 days after the person was at the casino?
I think this is probably a good question as well for Dr. Roussin, Carol. The notification protocols we've been following and the rules we've been following have been on the basis of the advice of our Chief Medical Officer as a professional in this field, and so we'll continue to respect that expertise and to act accordingly.
From CJOB, Diana.
Good morning, Diana Foxall from 680 CJOB. Mr. Premier, we have video of someone selling N95 masks kind of on the black market. The shot shows someone kind of pulling up to the apartment in the middle of the night and buying a box of the masks for twice the price they're going for. And obviously these aren't going for healthcare workers. What do you make of people profiteering on these much needed supplies when obviously the demand should be going towards healthcare workers?
Well, I'll look forward to getting the evidence that that's happened, and we'll act accordingly here. I think if it's conduct that you've described, it's shameful and disappointing. It goes counter to everything that I'm seeing from the vast, vast majority of Manitoba citizens who are respectful of the needs of our frontline workers to offer the services that we depend on in healthcare and want to make sure that they're protected first and foremost. Obviously, all of us are concerned about the safety of loved ones and ourselves, but the need right now has to be to protect our most vulnerable people. And our most vulnerable people are being treated by healthcare workers on the front line who need those supplies. So forward me that information and we'll take the appropriate action ASAP.
And just as a follow-up, what kind of action would the province take? What kind of measures would we be talking about as far as cracking down on anyone selling these kind of things on the black market?
Well, it's the first I've heard of it, so I'll tell you when we get the information, and then we'll probably talk about it tomorrow or in the next 48 hours.
From Global, Brittany.
Good afternoon, Mr. Premier. At the beginning of this press conference, you started talking about some teams that were calling in or video conferencing in, doing some team bonding. Well, we've noticed, there's some other areas where people are still not practicing social distancing, football practices that are still going ahead at some schools, whether they're school sanctioned or not. Toronto has brought in fines. They started issuing those a couple days ago. $750, I believe, was the fine people were being given if they weren't abiding by those gathering regulations. Are we going to start seeing it being cracked down on here in Manitoba?
Well, I'll continue to examine any issue you bring to my attention, whether it's from the media or other sources. We have now some call-in numbers and so on. But I have to say, in the first instance, this to the young people of our province: understand that previous generations fought and gave up their lives to protect their fellow citizens. Manitoba led the way in people volunteering for service in both the First War and the Second War. Young people did their part. They stood up and they did their part. And you have the chance to do your part now and protect yourselves, but protect other people too. Okay? So you're vulnerable. Other people are vulnerable. Follow the directives. Make sure that you're careful. Make sure that you respect each other, and make sure that you respect the people around you. You can save a life right now by listening. Listen very carefully to these directives. Abide by them. Because no government's going to stop people if they're all unwilling to listen. The fact of the matter is we need you to listen now. We need everybody to listen. If there are people coming back from abroad, isolate immediately. Self-isolate. Think of it as a quarantine. I don't like to hear these reports. No Manitoban likes to hear these reports because this is disrespectful to each other. This is not what good citizenship looks like. Listen carefully. Understand this is real. This is not pretend. This is not a video game. This is real. You have the chance to save lives. Do it. Listen and act accordingly and respectfully.
And my follow-up on that, we know you've spoken pretty sternly about us all working together to flatten this curve. Is it going to take cracking down, issuing fines, and making sure that people know we're serious about this for people to actually listen?
I would hope, Brittany, that it doesn't come to excessive measures. We have the opportunity to some degree with the state of emergency we've declared, the health emergency we've declared, to take actions beyond those we have taken. That is true. On the other hand, I have tremendous respect for the people of Manitoba, and I can tell you that whatever success we've had in withstanding or delaying or flattening the effects of COVID-19 is because of the citizens of Manitoba being caring people. And no amount of big government is going to change the nature of some people, I suppose, but we are doing our very, very best to make it clear that with the messaging we've been giving in many different ways, consistently, that this is in our hands as people. So I won't take off the table the possibility of further actions if people are blatantly abusing the rights and freedoms they have to come to take for granted in some cases. I understand we respect those rights, but we also respect the right of people to be protected at times like these, and we need people to follow these directives that we're laying out very, very clearly, that all of us are laying out very, very clearly.
Thank you.
You bet.
From the Brandon Sun, Drew.
Thank you. This is Drew from the Brandon Sun. And Mr. Friesen, does Manitoba Health have any estimates of how many nurses that the measure announced today could bring back into the system?
So we continue to work with the college and other sources to determine how many nurses may respond to this. And certainly we need the college to amplify this message. We need nurses themselves to amplify this message, to work with their networks, the people they know, to tap someone on the shoulder and say, now's the time. We've made it easier than ever with these measures, removing barriers to get nurses back to the workforce. But I can tell you that we've already received these offers of support, and we know in other provinces thousands of these types of offers have been received by nurses who want to come in and join the fight on COVID-19.
And just as a follow-up, but for the nurses who do come back, will they be distributed around the province according to need, or will they only be practicing where they live or where they're previously working?
So there's a broad variety of options, and when we think about how we could deploy nurses coming back from retirement, these might be people that we use on telephone lines at health links. They could be people that we put in wards. Those determinations will be, of course, made by our system leaders and administrators to know best how to deploy this resource. But it's clear that we are saying at this point, all hands on deck. It's been said many times that nursing is a calling, and a calling that doesn't ever really leave. And so we know that many nurses at this time are going to say, all hands on deck, I'm willing to step up and join this fight.
Thank you.
From the Winnipeg Sun, James.
Yeah, good afternoon, James Snell with the Winnipeg Sun. A question for Minister Friesen. I'm wondering if we will reach a point with the addition of new healthcare staff that we will attempt to dramatically expand testing for COVID-19 beyond those who are symptomatic?
So testing is important, and it's why we've put a lot of emphasis in trying to improve our daily testing at our Chatham Provincial Laboratory. I can update you on that and indicate, while I won't give away the message of Dr. Roussin, who will be here in a few minutes, that testing is up again. The lab has been working very, very hard, and even today we'll be joined by additional efforts. And as of today, Dynacare Laboratories has found a way to even assist further our efforts on the number of daily tests that are able to be processed. We recognize that testing is necessary. It's why we've opened up so many screening sites. The lab is working hard, and we also want to say a shout out to all the people who are working not just on the front line, but behind the scenes in areas like Chatham Laboratory to make sure that this effort is having effect.
I'd note that we remain among the Canadian provinces' leaders in terms of the number of tests that we've done. We continue to focus, of course, on the most vulnerable cases first, and we'll continue to make every effort to do what we can to alleviate the concerns many have about whether or not they may be infected, obviously, with the methods the doctors outlined and Cameron's outlined.
Thank you very much.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Premier, I know you've already announced a couple of measures to help people who might be having a hard time making the rent in this new situation, but those measures include a rent freeze and a freeze on evictions. You've hinted that more might be on the table, but now that it's the first of the month and we're hearing that people are having a hard time making their payments, are you going to offer any direct aid to renters?
Let's be clear, we've taken steps, other provinces have as well, to give greater security to tenants here in Manitoba, to protect them against eviction, apart from evictions based on criminal activity or unlawful activity and that type of thing, and also to give them the assurance that they want to have, that their rents won't be raised inordinately and put them under greater financial challenges. But let's also understand that renters alone don't bear the brunt of facing the challenges that we have as a province. Everyone is facing these challenges to some degree. Some have seen their life savings eroded. Others who own small rental properties have the same bills they had before, with tenants who are having difficulty paying them. Small businesses have been forced out of business because of decisions we have had to make to protect the health and well-being of Manitobans. Our civil servants, many of them are working double time on a number of projects. Our frontline workers face amazing challenges. All of us are under stress. We're all in this together, so let's understand that we're going to be supportive of actions that will address the most vulnerable people first, that will stand up our healthcare and social service systems to protect all of us, because that is what is under threat right now, and that will work in partnership with other levels of government, including the federal government, that's announced, I think, a very appreciated program that we'll be helping to promote and deliver to assist on filling that gap in the valley up ahead that we all see coming, to provide income supplements and support in addition to or adjacent to things like our employment insurance program that we've been funding for many years. So we're all in this together, and we all need to remember that as we encounter the challenges and as we face the challenges together.
And a follow-up question, somewhat related. Bad weather's coming this way. We're approaching the flood season. Have you asked for any help from the federal government in terms of reservists or other bodies to help with sandbagging and other tasks that social distancing might not permit normally?
Our preparatory work is well underway. We, as Cameron alluded to earlier, and it's a slogan, but it's true, we're preparing for the worst and we're all hoping for the best. The fact is that our flood forecast will be out, I think, in later today or tomorrow. And so you'll have the ability to ascertain whether that's an additional cause of stress or not. But one thing is certain, we're working in partnership, strong partnership with our municipal partners who will be at the front line if needed. in the event of a flood. And we're working very cooperatively with the federal government, who I thank for that cooperative tone on a number of other fronts as well. So we're preparing for any eventuality. But again, our first concern will be protecting our most vulnerable citizens, and right now that is protecting people who need our healthcare services, and that's what this announcement today is frankly all about. It's about making sure that we have that ability to sustain those services that are so important when they're needed.
From CTV Winnipeg, Jeff.
Hi, it's Jeff Keel, CTV. Is there any discussion about mandating nurses and retired healthcare workers back to the job?
Well, we are pleased to have previously signed a memorandum of agreement with nurses, with Manitoba Nurses Union in this province. That's a more collaborative exercise that does allow us to, if needed, direct nurses where most needed in the system under very, very irregular circumstances like these ones. But at this point in time, there has been no action that I'm aware of in any jurisdiction to take people outside of the workforce and compel them to come back. What this is it's a signal, it's an offer, we're opening the door, we're removing the red tape, we're eliminating the fees. We want those former nurses to come back.
Mr. Minister, on a follow-up question. We've seen what's happened in nursing homes in other provinces. What is the province doing to protect outbreaks there, and do workers in nursing homes have enough protective equipment?
So every day the issue of personal protective equipment is a focus for our government, as it is for all governments. As the Premier said, we continue to collaborate with the federal government. We are looking for further details about when we can expect the delivery of personal protective equipment into our jurisdiction. We need that in a timely way. We have sufficient supplies for right now, but we will require additional supplies. For personal care homes, of course, we suspended visits there more than a week ago. We have been issuing messages to say that everyone needs to be very prudent. We're speaking with labor groups about concerns being raised about what happens when someone might work in 2 personal care homes, and we're working through some of those detailed problems as well. I understand that additional messages were sent today by the Chief Provincial Public Health Officer to ask those personal care homes to redouble their efforts and to raise that bar when it comes to keeping people safe, because we know that is a significantly vulnerable population that we must protect.
From CDC Radio Canada, Patrick.
Yes, hi, Patrick Foucault from Radio Canada. First of all, thank you to both of you for providing French statement again earlier. That's very appreciated. So I guess my first question would be, and you can absolutely answer in English if you're more comfortable. Will Manitoba force in bed and breakfast and rental cottages to cancel reservations like we saw in Quebec?
C'est la première fois pour cette demande, pour votre demande. Congratulations, félicitations. At this time, I have no answer for your question. I'll look into it and we'll provide you with an answer.
All right, and I guess my follow-up question would be also a follow-up to Steve's question earlier. So we have viewers here who are saying that their landlords still increase their rents this month, even if you ask for the freeze of rent. So what would you suggest? If you could talk to these tenants, what would you suggest they do, maybe in terms of a legal approach?
Well, I think I talked to them rather clearly yesterday in saying such decisions are inappropriate at this point in time, and I think that already I've got reports that landlords have responded appropriately and adjusted their practices, so we'll hope that that behavior continues. Clearly, this is not a time to add uncertainty to the already existing stress.
And lastly, we have from APTN National, Brittany.
Good afternoon, Mr. Premier. Brittany Hobson with APTN National News. Several First Nations chiefs from up north have put out a call, I guess, to close down highways, specifically Highway number 6 to non-essential travel. As we saw our first case of COVID-19 in the north, I think that had some people on edge. What would be your response to that? Is that something the province would consider?
I think you were cutting out on me a little bit, but I'll do my best to answer what I think the question was. I think it was something about restricting travel within the province of Manitoba itself, and that is not on the table at this point in time, and nor is it on the table interprovincially at this time, apart from the existing stations we've established, 5 on the border with Saskatchewan, 1 on the border with Ontario, for checkpoints and for distribution of instructions to assist us in making sure that we're protecting our province in respect of those who come into the province, and giving them clear instruction on what they are mandated to do. Internally, I think that the practice we have adopted to this point in time of really pushing the educational piece so that we all understand how to protect each other. And when I say all of us, I'm saying that hopefully. I'm addressing that at people who want to practice football and others, to make sure that all of us understand that we have an obligation to protect ourselves and one another at this time, and to make sure we follow that. But at the same time, we are all mindful of the challenges this creates for people in rural and north. I grew up in a rural community, as you know. I didn't grow up in a rural community. I grew up on a farm 15 miles from a rural community, and I understand the challenges this creates for northerners, and as well in terms of accessing supplies, of being able to get the services that they need so they can sustain themselves, so they can protect themselves. And so at this point in time, apart from the educational initiatives that we've undertaken, we're not looking at restricting travel internally within the province of Manitoba, out of respect for the very real challenges that we're creating for people, not only in the city of Winnipeg, but in other communities around the province and in the rural and northern areas as well.
Just to follow up there, just to confirm that you wouldn't look at setting up possibly more checkpoints in northern Manitoba.
Well, again, I understand that a couple of communities, I'm looking forward to having another chat with our community leaders, Grand Chief Dumas and others, around other pertinent issues. We have exchanged information, but I'm looking forward to personally chatting. In any case, some of the First Nation communities I know, out of an abundance of caution, have done blockades on their communities. I think more as checkpoints. I was visited Long Plain First Nation on the weekend just to do a kind of a visual check, and I understand they were also doing informational distribution within the community to protect residents there from people coming in who may have been a risk or posed a risk. So I see various First Nations communities taking measures to protect their people. I respect the right to do that. But at this point in time, again, not additional blockades internally within Manitoba. The reinforcement of the messaging and the reinforcement of the checkpoints on our borders with Saskatchewan, of course with North Dakota and with Ontario, very much an emphasis at this point in time.
Thank you.
I want to say again, at the risk of having to, at the risk of going too far here, I don't want to go too far. I just want to say thank you to the members of the media for your diligence and work too, because frankly, we need to understand that without the work of the media in our province, the messaging that we're trying to get out there about public practices better designed to protect each other wouldn't be getting out as effectively. And so I want to say thank you to you for that. We're going to have a special event tomorrow just for children, a call-in that'll, I hope, assist families dealing with stress, children dealing with stress at this time, to get some answers to questions, to share their perspectives. Yesterday, I made the recommendation to children not to share those sippy cups and not to share their musical instruments. I want to say a special thank you to little Nick, who sent me his picture with his trombone in his hand and said he was keeping that trombone to himself. I appreciate that, Nick. Thank you. Keep up the good work, because we're all in this together. And when you do that, you protect your brother and sister and your mom and dad too. So keep up the good work, Nick. And for all of you, remember that we appreciate your work right across the province. Keep a steady hand, keep calm. Remember that by working together, doing the right things, you can save a life and we can beat this COVID thing. Thank you.
You're just like kidding me? They stay here for 2 hours.
I know the canteen's closed. Just until things get back to normal. Time for some sanitation. It's the D10 I call it.
Doing the mic momentarily.
That was barely 6 feet. I'm trying to find. Should have dove across the table.
Mic check 1 2. Mic check 1 2.
Sorry again.
I was going to give you a clerical, that person has to be sitting stroking the computer.
My favorite comment now is to say one tiger's length away from me. Like I'm only about two episodes in, and I'm just redneck or wrong.
I'm not into it at all because I know it's to me, it's just Kardashians all over it. I don't need that much.
It's redneck Kardashians, 100%. I never felt my face or eyes so itchy as they have since you told me I couldn't touch them.
Well, you know what works? Just get your hand, if you're going to scratch your eyes, just go get some alcohol, wipe on the cigarette butt, and then
Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing 24 new cases of COVID-19, taking our total to 127. The total number of deaths related to COVID-19 remains at 1. As of this morning, 4 individuals are hospitalized. 3 of those are in intensive care. Our data indicates 4 individuals are listed as recovered. Public health investigations are continuing, and further details and information will be provided on our website as it becomes available. On Monday, 1,130 tests were completed at CADM Provincial Lab, bringing the total tests done to date to 10,044. There have been cases identified in healthcare workers at St. Boniface Hospital and at Grace General Hospital. Public health investigations are continuing, and any close contacts will be contacted directly by public health. Any details about other cases will be provided if there is public health reason to do so. I can confirm that public health officials are seeing early signs of community transmission in Winnipeg. Public health investigations have not been able to confirm if several cases have had any connection to travel or to other confirmed cases. We knew to expect this as more and more cases are introduced into a jurisdiction. Community transmission is going to be inevitable. This is the point in time where we would begin to initiate our social distancing strategies, but we have been ahead of this and have had many of these strategies in place at present, and we're going to continue to enhance those strategies over time. We've made clarifications to the public health order issued on March 30th to ensure businesses that do not provide critical services understand that they are able to operate during the state of emergency. Those non-exempt businesses may continue to operate where customers can order goods online or by telephone. Customers cannot attend a business premises or property to order goods. Those companies can continue to sell goods to customers where those goods can be picked up at the curbside or delivered to customers. Customers cannot pick up goods at the business premises or on its property. Staff are allowed to attend business premises without limitation on number of staff as long as they take appropriate measures to ensure social distancing of the 1 to 2 meters occurs. Businesses can accept delivery of goods and may allow services such as construction, repair, maintenance, and cleaning to occur on their premises and on their property. Examples may include a garden supply center may allow staff to enter the premises or property to prepare bedding plants. The center may sell plants online or by telephone, but can only allow customers to pick up plants at the curbside. Hairstylists may allow staff to attend premises to prepare products for sale. They can sell products online or by telephone, but must not allow customers to pick up product within the business. Golf courses may allow staff on property to prepare for opening, but cannot allow members to play golf or undertake any regular activities at this point. All of these socially distancing strategies are here to flatten the curve, to limit exposure to COVID, to interrupt the transmission of this virus. So these strategies are important to practice continually. Now is the time to stay home. I can't stress that enough. We see this virus being transmitted. We see our numbers increasing over time. We have seen significant and serious outcomes. Now is the time for social distancing. Stay home. If you must go out for essentials, do so alone if you can, and practice social distancing strategies at all times. This is our chance to interrupt the transmission of this virus, but we rely on all Manitobans to do their part. Stay home if you can. If you go out, practice social distancing, and only go out for necessities. This includes all Manitobans. We hear of cases in certain communities, in certain regions. This should not change your approach. The approach right now for all Manitobans is social distancing. Stay home. If you're aware of a case within your community, stay home. Practice social distancing. If you're not aware of a case within your community, stay home and practice social distancing. Those who have a fever, cough, stuffy nose, sore throat, it's vitally important that you stay home. Do not attend a workplace. Do not go grocery shopping if you're ill. Stay home. If you have any concerns, call Health Links to get the direction on whether testing is required. If you have more severe symptoms, shortness of breath, you may need to seek medical care, and I would encourage you to do so, but call Health Links, call first. I know these are challenging times. Social distancing strategies puts added strains on individuals. These public health orders have put strains on many small businesses. We would not be implementing these strategies if it wasn't an extraordinary time. This virus, we are now seeing community-based transmission. Now is our time to act, to interrupt the spread of this virus. But we can only do so with the help of all Manitobans. We all have that role to play. We are all in it together. Now is the time. Stay home, and stay home. If you must go out, do practice social distancing at every opportunity. Stay 2 meters away from everyone if you're out. Wash your hands. Those who are at increased risk of the severe outcomes of COVID-19, those over age 65, those with underlying medical conditions such as cardiac conditions, respiratory conditions, any medical conditions, especially those with immune compromise, should be staying home. Reduce your risk of being exposed to this virus. Again, we encourage all Manitobans to use credible information in their decision making. Do not repost unfounded rumors. Do not spread rumors. Use credible information. We've heard of cases of people being bullied who are cases or suspected cases. This is not useful. This will not help against this virus. Now is a time for us to work together, to support each other, to reach out, to offer a hand to other Manitobans. We just need to ensure we're maintaining that social distancing, not social isolation, not bullying of others. Working together, we'll be able to decrease the impact of this virus on our communities. Staying home means that includes family get-togethers. We know there's holiday seasons coming where there might be large family gatherings, which are the norm. This is not the time for business as usual, though. Now is the time to stay home. Now is not the time for large family gatherings. Look for other ways, virtual gatherings. Ensure we stay in touch. Ensure we're reaching out to vulnerable populations. But now is not the time for large gatherings. Now is the time to stay home. Even though we see this virus circulating, we see our numbers going up, we are not helpless. We are taking all of these moves. All of these implementation strategies are to reduce the impact of this virus, to interrupt the transmission. So our actions will have that effect, but we all need to work together to do this. And I encourage all Manitobans to take this very seriously. Stay home, practice social distancing, and together we're going to work to flatten the curve of COVID-19. So thank you very much. I'll pass it to Lynette.
Thank you. So I want to start today by letting you know that new screening criteria procedures are being implemented for staff across all areas of Manitoba Health System, starting with those who are working in acute and long-term care facilities. These measures will begin being implemented today and soon be in place in all facilities and services across the province. The staff arriving for the start of their shift will have their temperature taken and be required to answer questions about any symptoms they may be having, their travel history, and their exposure to COVID-19 cases. Staff who are required to come and go during the course of their shift may be rescreened upon entry into the facilities and service areas. This decision follows confirmation of healthcare employees at 3 different sites testing positive for the virus in recent days. We must ensure that we are taking every possible measure to ensure our staff and our patients are protected. Staff must stay home if they are ill, even if their symptoms are mild. We have a duty to protect our patients, our staff, and our community to ensure that we need to take every precaution. The public yesterday was informed about a positive case involving a Selkirk Regional Health Centre staff member. And as Dr. Roussin noted, there are now cases involving employees both at the Grace Hospital and St. Boniface Hospital. No patients have been identified in either cases as being in close contact with the individuals. However, numerous staff contacts have been identified. So both investigations at St. Boniface and at Grace Hospital are ongoing. Upon learning of the results in both these instances, all staff who were identified as close contacts while the individual was symptomatic, they have been sent home to self-isolate for 14 days. Both hospitals where these individuals work have been thoroughly cleaned, and normal service delivery now continues. It is clear, however, that these exposures have had a significant impact on our staff, of course, as well as the operations in providing service delivery. So we are working with both sites to ensure that they will be able to be staffed appropriately, and we are investigating any other steps that may be required to ensure that staff are appropriately protected. This news, of course, is very upsetting to us, and our thoughts are with the staff members who tested positive, as well as all of their colleagues at the respective sites. We also know this news will be distressing for the public, and our investigations have not identified, I just want to repeat, not identified any patients at the site as being in close contact with these most recent individuals. These cases, though, should serve as a cautionary tale for all Manitobans, including healthcare workers, as we all have a duty to protect ourselves and our community. So more than ever, that duty does include staying at home if you're sick, even if the symptoms are mild. So we will succeed in flattening this curve, but we do all have to heed that message. The other thing I wanted to speak about, which we've been talking in the last couple of days, is part of our planning for COVID-19. We have been preparing for a time where we need to support people and help provide spaces for people who can't properly self-isolate at home. So we are looking at other spaces outside of people's regular dwellings, and because we know that the ideal location for the vast majority of people for COVID-19 is to recover at home, there are people who don't have a home or whose homes they cohabitate with people who have chronic diseases. Or it may be just very difficult to self-isolate and minimize the risk to loved ones. So we're also looking at the need for healthcare workers who may need to limit the risk to their families. So a request for proposals has been issued by the Manitoba government to help us with this task, and it closes tomorrow afternoon. We anticipate that hotels and inns and motels will step up and offer their services, but we are open to all possibilities. For now, only urgent situations for COVID positive patients or healthcare providers will be considered for staying at these locations, but we will definitely, as we have been planning to escalate and expand criteria so that as this pandemic grows and the numbers grow, that people have a safe place to live. I also just want to highlight a memo came out from our incident command highlighting that care for patients in Nunavut as well as Northwestern Ontario will be accepted and cared for within the Manitoba hospitals. For the purposes of infection prevention and control, these patients and their escorts who normally reside in Nunavut or Northwestern Ontario will be considered Manitobans and subject to the same screening and precautions as other patients in our province. Just a quick rundown on the stats. So our online assessment tool garnered about 7,000 web views yesterday, and since launching more than 2 weeks ago, the English and French versions have had 365,000 web views. Dynacare is also still plugging away at the backlog of phone calls, and they yesterday made 1,200 calls to patients to let them know about negative results. As a reminder, those of you who have positive results will be contacted immediately by public health. And we hope to have HealthLinks data for you tomorrow or Friday. And we will also have an update tomorrow for you on the new community testing site at MPI's Main Street Service Center. And one more thing just before we turn it over to questions. We know a lot of parents out there are getting questions from their young children about COVID-19. And it's an unsettling time for all of us, kids and adults alike. Tomorrow morning, we have Ace Burpee and Dr. William Lee, who's a pediatrician in Manitoba, and they'll be talking with kids about the changes that are happening right now and answer any of their questions. So people can watch along on the Manitoba government's YouTube channel starting at 11 a.m. So please tune into that. And if you have any questions, please feel free to send those questions to covidquestions@sharedhealthmb.ca. And with that, we can open the line to questions.
A reminder to reporters on the line that you will have a primary question and a follow-up question. And please reintroduce yourself before you ask your questions. From CDC Manitoba, Bart.
Good morning, Bart McKeever, CDC Manitoba. Dr. Roussin, when we're looking at the data online, what do you make of the distribution of cases, specifically all the young women aged in the 20-something decile?
That's right. So that would make up the highest proportion of positive tests right now. I don't think there's much we can make of that right now. There's lots of reasons why that might be. For some reason, that might indicate much more testing being done in those in that age group. But I don't think it's really the focus right now. What we focus on is those at highest risk of severe outcomes. And so we'll continue to monitor these trends and then report if we notice anything significant.
Okay, and a follow-up question from Mr. Ardusa. While the Premier was speaking, the Newfoundland issued an urgent plea saying that they are running out of time with money and they're not getting their protective equipment. What is the status of the protective equipment here? Is Manitoba getting it on time? Is there a similar degree of urgency, and if not, what's the situation?
Well, from what I understand in speaking with our logistics team, that we do have enough supply for several weeks, maybe months for some, depending on the supply. And there are orders that are expected to come in. They have been coming in so far. If there is any change to that, we will for sure be transparent and let people know that. But at this point in time, I have not heard any abruption or stoppage of the orders. We continue also to work with the provincial and federal people because it is a big order for all of Canada, and so those conversations are happening.
Thanks.
From City News, Mark.
Hi there, Mark Neufeld, City News. The new screening procedures, doing temperature tests and then asking questions for staff entering. If we thought that this was coming, why do it now? Why not have started this weeks ago?
Well, the staff who have been COVID positive have been at work and not feeling well, and we need them to stay home. And so that is one objective way where we are able to identify if they are sick or if a temperature comes before maybe the sniffles or a cough, that maybe we can catch things earlier. And if they show up to work, we can send them home if their temperature is up. So it's really prevention, and we know staff are doing the best job they can, and they work as teams, and they don't want to let their teams down. And but if you're not feeling good, you shouldn't be at work. And if we can catch that with your temperature before you catch that with other symptoms, we're gonna do everything in our power to do that. So the question is, why didn't we do it before? Well, there wasn't community spread before, I guess. Most of them were related to travel, and people were self-isolating. So as things evolve and change, we're going to adapt our plan.
Now that we're sort of talking about it being community-based, what other plans might we see changing in coming days, or how does this change? I mean, I know we're still messaging for people to stay at home and have distance between them, but how is that messaging maybe going to change in the community?
Yeah, well, so certainly this would normally be, getting to that trigger for these social distancing strategies. So we've already had them in place. So this early community-based transmission may not immediately change a lot of what we do, because we've already had a number of the factors in place. But the staff screening certainly is that. We're looking at different methods of using personal protective equipment as well within facilities. So a lot of the changes that normally would have been triggered by this, we've already had in place.
From the Winnipeg Free Press, Larry.
Larry Kush at the Winnipeg Free Press. Dr. Roussin, could you say how many hospital workers have tested positive in Manitoba for COVID, and how many others may be self-isolating as a result?
Yeah, so I definitely don't have a total number on how many might be self-isolating right now. Some of these investigations are ongoing. The total number of healthcare workers, I don't have that number. I know that we are going to be trying to find a way to be able to report that better, especially if we are able to report whether there's a strong indication that an individual acquired it at work. So we're working on ways to be able to report that.
I'll follow up on another topic. Why did public health authorities wait until last night to post a bit of information on the website about Club Regent Casino? Apparently, a customer who had tested positive was there March 16th, but yet we had no inkling of that until March 31st. Can you tell me why that occurred?
Yeah, I know that the report of that did come to public health right around the time when we reported it. And looking back, it was felt that the actual exposure at Club Regent was very low risk. So it wasn't really something that was considered that needed to be widespread. But since we've now have that area on our web page with various events, we posted it there as soon as we heard about it centrally at Public Health. But the actual risk to anyone at Club Regent at that time was low.
Just to clarify, when did Public Health learn about this?
Yeah, like public health at Manitoba Health Surveillance, I believe we got that report on the night before we posted it.
On the 30th.
When was it? I think it was posted on the 29th, I believe. 29th, I believe. So it was the day before that is when we received it at centrally at Public Health.
Thank you.
From CJOB, Diana.
Good afternoon. It's Diana from 680 CJOB. Dr. Roussin, we've clarified the rules for non-essential businesses and their ability to operate with online sales and curbside pickup, that sort of thing. What would enforcement look like if a non-essential business isn't closed as mandated?
Right, so this would be initially under the mandate of the public health inspectors, and they would approach that business owner, advise them of their requirement to comply. Most times that's effective, very high rates of compliance period, and then even higher rates when just approached by a public health inspector to ensure they're comprehending the order and what they should do to comply. Barring that, then there are further orders and penalties under the Public Health Act that could be in place.
And just as a follow-up, what is the plan for pharmacists in Manitoba? Will they at any point be issued personal protective equipment, or is that kind of not in the plans for the time being?
That's not right in the plans right now. So again, this is spread by close, prolonged contact. So being, across a counter from someone is fairly low risk. And so we'll look at all of these things as things develop. But close, prolonged contact is how this is spread. And so only people who are within that close space assessing clients are required to wear personal protective equipment.
From Global News, Marnie.
It's Marnie Blunt from Global News. Dr. Roussin, now that we're seeing early signs of community transmission and we have confirmed cases with healthcare workers and then the case of the casino, how will this impact testing? We are screening healthcare workers now, as was announced today, but how will this impact testing for members of the public? Are we going to be seeing more widespread testing, or at what point would we see something like that?
Yeah, so that's those plans are certainly in the works to deal with the capacity and who we're going to be testing. So certainly within the hospitals and healthcare workers, we're testing now. You can see that the CADM lab ran over 1,000 tests yesterday, and so that's not just going to be returning travelers, and so we're seeing testing is spread. We're still focusing on returning travelers who are symptomatic, healthcare workers who are symptomatic, or those congregate settings or First Nation communities, but again, only symptomatic people. But as time goes on, we might open it up to all symptomatic people. But really, at this point, the social distancing strategies are vital. But what's also vital there is stay home if you're sick. So again, if we're not testing everyone, but somebody stays home when they're sick, then we've accomplished the same thing. They're not going to be spreading that virus or whatever virus they may have. So really important messaging. Even mild symptoms, stay home if you're sick. With or without the test, we're dramatically reducing the transmission of a virus.
And the next question is, we also asked the Premier about this. We do a video of some people who appear to be selling gear, personal protective equipment like face masks. What's your response to that, or your message to people who are trying to profit off things such as this?
Yeah, my message is we're in a pandemic. And if we as Manitobans want to get through this, we're going to need to be working together. We're going to need to be following credible advice and searching for credible information. And we're going to need to protect our healthcare workers. And so our healthcare workers are vital to our response. They're our personal protective equipment needs to be in the place that it is most important, and that's in the hands of healthcare workers. So there's really no use for the general public to be using masks, and those masks are much better utilized by healthcare workers. So I would encourage everyone to start knowing your role with this pandemic. Everyone has that role. Everyone can play a big role, and that's to stay home, practice social distancing, protect our healthcare workers.
Thank you.
From the Brandon Sun, Aaron.
Hi, this is Aaron with the Brandon Sun. As I'm sure you're aware, Fremont House is a pretty large area, and Weston residents are quite concerned as the number of cases are rising, and especially now with early signs of community-based transmission. So I was wondering, can you or will you be providing a more specific breakdown of cases, even if it's just, saying what's in Brandon versus surrounding communities?
Mm-hmm. Yeah, well, I would encourage everyone there to again, listen to the credible information on this virus. So that information should not be of any benefit to anyone, right? If you have a known case right in your community, you should stay home and practice social distancing. If you don't have a reported case in your community, you should stay home and practice social distancing. So, so I'd encourage people that type of information should not change your behavior right now. Now is a time for all Manitobans to stay home, practice social distancing, and knowing that there's a case that might be in your community or a community next to you shouldn't change your actions. So all Manitobans, now is a time for action. Stay home, practice social distancing.
Thank you. And just as a follow-up, will these new screening measures, are they also going to be put in place for staff in personal care homes or visitors the few visitors who are allowed into hospitals at this time?
Yes, we're going to have to be looking at that. So our goal is all facilities for sure, and we're going to have to figure out a plan for community healthcare workers as well. But we're starting with the facility base, so acute care and long-term care would be included in the coming days for screening.
Thank you.
From the Winnipeg Sun, Scott.
It's Scott Billis here from Winnipeg Sun. I can appreciate that, this is changing every day and then community transmission system now, but I'm still looking for kind of a clear answer to why healthcare workers in the city and across the province and facilities where acute care and all sorts of different types of care is done, why they weren't screened right from the beginning. Because obviously this is happening now, but why wasn't this done earlier to stop what we're now seeing in hospitals?
So, well, I mean, there was, right from the beginning, there was a lot of policies put in place, a lot of messaging, a lot of education to deal with this. And so certainly at that time, we thought that with all the healthcare workers knowing how important this is, with the education, with the policies in place to prevent this, we were expecting that, just that. When we see these other cases, now we see that, a lot of times these are very mild symptoms, and people go get tested, they test positive, and then realize, actually, it was, I think, the day before maybe those mild symptoms started. I didn't really notice it. So there's a lot of things that weren't predicted. But we just now are going to respond when we saw a couple occasions like this. But right from the beginning, we knew how important it was to not have ill healthcare workers at work. And so there was a lot of policies, a lot of procedures in place to prevent that. And then so we see now there's been, so I mean, this has been going on for a while, and there's lots and lots of healthcare workers. So these are just a few very rare examples of what's happened. But we'll respond and try to make sure it doesn't happen again.
And just a follow-up, at what point now with community transmission even in the earliest signs of it, are you guys, I guess, looking at a lockdown, whether it's a citywide, province-wide, that sort of thing?
Well, I mean, it depends on how, how we frame that. I think that we've been messaging, along those lines for weeks now, right? I mean, it's stay home. Now is time to stay home. Practice social distancing. Only leave your house for essential reasons, and do so alone if you can. Practice social distancing at all times. We've limited a lot of non-essential businesses from operating. And so we have a lot of things in place right now that should result in the flattening of this curve, in the interruption of the transmission. So we can always are reviewing our strategies, and have you seen we've enhanced them over time, and so we may still do that. But we've just today, in putting into effect these enhanced social distancing strategies, and we're going to see how things transpire from there.
Thank you. From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. Steve Lambert from the Canadian Press. You mentioned that now that we have confirmed the three healthcare workers. I know you mentioned the one yesterday was a direct result of travel. Is there any indication yet to the two other cases whether it was community transmission or travel, or even whether they perhaps caught this in the workplace?
Yeah, so these ones are currently under investigation. So we're still going to look to see if there are, is there evidence where it was acquired. So we'll be able to have more information on that as the investigation goes on. And, I think that healthcare workers who it's likely that they've acquired it in the workplace, that's going to be something that we're going to try to be able to articulate if we see that.
Okay, and as a follow-up, you're starting to see early signs of community transmission in Winnipeg. What are those signs, and were the two healthcare workers in Winnipeg among those signs?
Well, these ones here are still under investigation. So we've seen a number of cases, 4 or 5 cases that we can't link to travel or to a known transmission chain. And so these are some of these what we would call pop-up cases where we can't link to a transmission chain. It's also evidence that even though we have these testing strategies going on, we are testing people in the community that don't actually meet it, or we wouldn't have been able to find these cases. So, but that's what we're seeing now. So people without a known transmission chain or recent travel, we found are positive. So that would give us that hint that we're starting to see some community-based transmission.
Thank you.
From CTV, Michelle.
Just a follow-up to that, Dr. Roussin. How were these ones found then? Were they from tests inside the hospital, or can you explain that?
So I can't speak to where these were tested, but it's kind of like I was alluding to there. So when you're running 1,000 tests in a day, it's very unlikely that that's 1,000 symptomatic recently returned travelers, right? So although that's our testing criteria, we knew all along that we're reaching other groups, and here's examples right now that's coming up. So we're not changing our testing criteria now, but there's a lot of testing getting done, and so some of them are going to be falling outside of our defined criteria.
Okay, and just a question on another matter. How concerned are you about the virus being shared into long-term care facilities through people like home care providers? And should they be wearing masks, those people, or will those people be screened?
mind, or? Oh, okay. So we're talking about the home care providers on whether they should be screened?
Or, yeah, whether they should be screened wearing masks when they're going into a place like a long-term care facility.
Oh, so for long-term care facilities, they are going to be included in our approach of screening healthcare providers. We're looking at different strategies for personal protective equipment in all facilities as well. So we know long-term care facilities has a number of risk factors there to people who could develop severe symptoms of COVID. So we'll take all precautions there.
But currently, Michelle, they do screen before they go in the home or as they come in the home. They do have access to personal protective equipment. And but as we evolve and adapt how we're screening staff, and then we will make sure we include the home care people as well.
All right, we have time for one more round of questions, but we'll just take one question, no follow-up on this round. Back to Bart at CBC Manitoba.
CBC Manitoba, Bart McKee this year. Dr. Roussin, Ontario just released today an open data portal, full age, gender, health status, travel indicators, health region for each of the known cases. When will Manitoba follow suit?
Yeah, I think we're getting our numbers are starting to increase, and so we'll continue to update the our website, and I think that is a goal that we can start to provide a bit more detailed information as the numbers increase. It's much less likely to be able to identify any individuals as the numbers increase. So we're looking to be able to function in that transparent manner so people can see the nature of the cases.
And I know you said one question, but briefly, Mr. Ragusa, all workers going to hospital screened or just healthcare providers? Like our maintenance workers, delivery people, cafeteria? Is everyone going into hospital getting screened?
Healthcare workers who are in direct patient contact will for sure be screened.
And everyone else?
From City News, Mark.
Mark Newfeld, City News. Just on the heels of sort of the announcement, we're looking for retired nurses or returning nurses to enter the workforce. If there is a large surge of people joining the front line and fighting against COVID, will we have enough protective equipment to offer everybody if there's a huge spike in people joining hospital workers?
Well, it depends where those that workforce would be deployed. So we've talked previously about there's many different priorities right now in this pandemic. So it might be working in health links. There's a lot, as these numbers grow, the public health office needs a lot of support. So there's not so much equipment there, like there is digital health, kind of computers and laptops. But for that, yes, we would make sure there were enough supplies. And for the hospital, we have been planning for many months for this event, and there is equipment, supplies, and space available to us.
From the Free Press, Larry.
Larry, Winnipeg Free Press. Dr. Roussin, I'm wondering, with the health workers in Winnipeg who have been tested positive, are these primarily ER workers, and are ER workers needing greater protection given if they are in fact the most vulnerable health workers?
Well, I think that certainly those at the front line are going to be most likely to be exposed to undiagnosed cases. I think that makes sense. So certainly right from the beginning, the protocols and processes are in place for that. We've now are looking at enhanced ways to to address things like the screening of healthcare workers. We're looking at other personal protective equipment procedures to address that. But I think it's most likely that anyone with the primary contact with clients is most likely to be exposed to an undiagnosed client.
And I would also say emergency certainly is one area, but there's lots of areas that have direct patient contact that we would be concerned about, including paramedics and home care and anyone who has direct patient contact.
CJOB, Diana.
Diana from 680 CJOB. Just a quick question. I noticed Justice is seeing some changes as a result of COVID-19 with new inmates being isolated for 14 days as well. Has there been a case of an inmate testing positive for COVID-19 in Manitoba, and what are kind of the implications on correctional centers for this? Obviously, I don't know how big of a toll this is going to take if every new inmate has to be isolated for 2 weeks.
So I'm not aware of any positive case from a correctional facility here. Certainly this is a bit in response to seeing the increasing amount of cases, seeing some of that early community-based transmission. So they're going to take those extra steps. I can't speak towards the the capacity they have and the actual procedures they put in place to do that. But it's just another move forward in the systematic approach to this to the virus. That now, as we're transitioning to community-based transmission, certain changes need to be made.
From Global News, Marnie.
It's Marnie from Global again. We're getting some questions from viewers about social distancing in public places. People saying they're seeing a lot of people crowded in Assiniboine Park, for example. We've seen, high school students or young people still getting together and playing football. Would the province look at monitoring any parks or anything like this, or will we see any steps like that taken in the future?
Yeah, I think as this order is taking effect, and we'll be looking at public group sizes, certainly they're limited to 10. We want everyone to be practicing this social distancing. And it's really about getting that message out there. And, that these actions, staying home when you can, going out only when it's necessary, practicing social distancing, it really comes down to, it's a chance to potentially save a life. We see this virus being transmitted, and the best way to interrupt that transmission is to stay home. And if we all, chip in, we all work together and do this, we can significantly affect the transmission of this virus. So that's the message, is that by doing your part, you're saving lives in Manitoba. And so I'd encourage all Manitobans to take that seriously, do your part, stay home, and practice social distancing at all times.
From the Brandon Sun, Aaron.
Hi, Aaron with the Brandon Sun again. I'm sorry if this has already been addressed, but have there been any residents or employees of personal care homes or long-term facilities in Manitoba who have tested positive or are under any sort of investigation?
We don't have any residents who've tested positive right now. We have many investigations going on a number of cases, and so certainly an outbreak or a case involving a personal care home client, that's something that we'll be discussing if we become aware of that. But right now, I'm not aware of any residents at a personal care home right now.
Thank you.
From the Winnipeg Sun, Scott.
Yeah, Scott Bullock here again with Winnipeg Sun. Just looking at the Engage Manitoba site where it talks about the new public health orders issued last week there. There's 45 pages worth of questions on the Q&A. Is there any plans to kind of maybe streamline it better for folks who are just unsure of what businesses or whatever. I know the public health org has a lot of, legal jargon and stuff like that. Is there any hope of changing that or giving a list to people where it would be more easily digestible?
Yeah, well, it's difficult, when we're dealing with many different businesses and industries. When you're writing an order, it has to be written in an effective way like that. That website itself is designed to answer questions. And so it's interactive. People can pose their questions on there if they're not sure if it applies to them. And so I'd encourage everyone to ask questions. But again, my message has been the same: is that no one needs an order to get them to help Manitobans reduce the impact of this virus. So I'd encourage people to go for credible information. Ask questions, find out if it applies to your business. But whether it does or doesn't, everyone needs to be doing their role to limit the transmission of this virus. And so that applies to businesses whether you're listed or not there. This is about Manitobans' lives. And so everyone has that role to do their part.
From the Canadian Press, Steve.
Hi, Steve Lambert from the Canadian Press. Dr. Roussin, now that we're seeing the early signs of community transmission, are you expecting the rate of new cases to accelerate as we've seen in other provinces?
Well, that's what we've been expecting all along. We will see that cases will be introduced into the jurisdiction, and you'll see that over time, and we'll see quite a variability of days where we see no cases and then a few and then sometimes a lot back down to a few. But as you start seeing that community-based transmission, certainly if we don't put in measures to interrupt that transmission, that's when you start seeing the climb towards the peak occur. And so that's what this is all about, is to flatten that climb and lower that peak. And so yes, as we get to this stage, we're likely to see more and more cases daily, but we're doing all these things to really limit that climb.
And as a follow-up, Public Health Agency of Canada, federal officials, and people in other countries have said you can expect a 30% infection rate. So should we be surprised if we see 100,000, 200,000 people come down with this, mostly with mild symptoms?
That's right, and so the vast majority of cases, about 80%, are mild cases and expected to recover at home. We see different models around, and so you certainly see attack rates being listed in some models as high as 30%. So we're preparing for scenarios such as that. But again, I reiterate, we're not just helpless and dealing with a certain number that we're going to get at. These social distancing strategies are to adjust those numbers. And so we're doing our own modeling numbers, and we'll hope to get some of those out to Manitobans just to give an idea. But they're all estimates. They're not carved in stone. We can do things that can change those estimated numbers, and that's what we're working on now.
Thank you.
From CTV, Michelle.
Hi, Michelle from CTV. I'm wondering about enforcement. We have been told that someone reported a store to public health inspectors, and they were basically told back, call the store yourself. This isn't in our scope yet. So really, who is enforcing it, and what can people do now until there is something in place? And one is maybe for something to.
Yeah, so I can't speak on that specific incident, but it is certainly in the scope of public health inspectors if a store was operating outside of the orders. And so certainly there has to be some sort of a triage of complaints. There's a number of different complaints that come in, taking various urgency, but it certainly is in there. But these measures have just taken place this morning, so I'm not sure when the call was made, but we'll. We do have the public health inspectors, and it certainly is within their scope to visit businesses that are falling outside of the public health orders.